Hey everyone, thanks for joining me to talk about pain. And this is the second installment of posture and how it contributes to pain. And the first one we talked about that it triggers an extension problem. And I mentioned in that video that there are two general patterns that are causing most back pain. And in today's episode, we're going to be talking more about unilateral back pain. Back pain is more on one side than the other. And this also will include things like sciatic pain down one leg or SI joint pain down one leg. So we'll talk today about how your posture strategy is contributing to these patterns and therefore your pain. Okay? Again, if you're listening to this via audio only, I've created a video of this on YouTube, and I'm going to be using my skeleton to demonstrate some of these things. So you might get more out of this episode if you just jump over to YouTube and watch me on YouTube. Okay, so here we go. So last time, like I said, we identified that you had an extension problem, which means that your back is it has too much arch, and that's one of the things that's contributing to your pain. And I showed you how your posture strategy is contributing to that pattern and therefore your pain. So the second one that I want to talk about is what I call a side bending problem. And that is a pattern where one side of the pelvis is higher than the other and one side of the rib cage is lower than the other, which, as you can imagine, creates compression on one side of your spine, right? Because of that pattern, okay? So this would be in this picture, let's see, I'm showing you the right pelvis is higher than the left and the right rib cage is lower than the left. So this would be a right side bending problem. Now, why is the side bending problem occurring? Well, in 80 to 90% of the cases, it's due to an older problem down this leg. And what your body does is, just as if you had a little rock in your shoe and were asked to walk on that all day, your brain would say, oh man, that hurts every time I step on that foot. So I'm just going to make this little adjustment so we're not stepping on that foot so much. And so what your brain does is it starts to hike up that pelvis to get off of that foot. Well, the same muscles that hike that pelvis up are attached to the rib cage here and therefore pull the rib cage down, creating this side bending problem. And it solves the problem that you don't want that pain from that little pebble in your shoe anymore. But from a longer term perspective, what happens is your brain then forgets to stop creating this problem anymore. And so this pattern exists to even if that pebble is gone. Okay, so what are the things that we're doing posturally that's contributing to this pattern? Well, especially if you have unilateral back pain or sciatic pain or SI joint pain on this, usually it's the high side of the pelvis. What you're going to start doing is you're going to start shifting to the opposite side. So if this is happening on the right side, you're going to start shifting to your left side. So I'm going to show you a little what happens when you do that. So go ahead and with your hands, what I'd like you to do is just put your hands on your waist muscles here, just like this, and I want you to squeeze them a little bit so you can feel that the muscles in there. Okay, so now what we're going to do is I'm going to ask you to stand on your right leg, all right, and lift your left knee just a little bit. And what you'll find is that the right waist muscles are more relaxed than your left waist muscles. The left waist muscles are engaging to help advance that left foot as if walking, all right? And strangely enough, the right waist muscles are lengthening and relaxing to allow lengthening on this right side to help advance the left leg. And if you keep your hands there and now stand on your left leg and lift your right knee a little bit, you'll feel the opposite happens on your left side. Your left waist muscles relax and your right waist muscles engage as if to help advance that right leg. And this is the way a lot of things work in the body, is that you have this idea of reciprocal inhibition happening. And so anyway, if we have, let's say, that right side bending problem again, like I mentioned here on the skeleton, and we shift our weight over to our left to get off of this pain that has been created, you'll now understand that by shifting your weight to the left, you're actually perpetuating the contraction pattern on this right side. So that would be my first recommendation for someone with a side bending problem, Or let's say you have sciatic pain or SI joint pain on one side or unilateral back pain on that side. Pretty much it's assured that you have an elevated pelvis on that side and a depressed rib cage. And with your attempts to offload that, you're actually perpetuating the pattern that is occurring that's causing the pain in the first place. This happens both with sitting and standing. So that's the intuitive fix, is to shift off of that side, but again, you're perpetuating that pattern. So the non-intuitive solution is to actually load the side more, because what you've just found with our little test here of what happens with your waist muscles when you lift one leg versus the other is that the weight-bearing side actually is the side that is lengthening and relaxing. So the more that you shift to the side that's causing your pain, that will start to trigger these muscles that are contracted to turn off. Now, where do we go wrong with that? Well, a lot of people, when they will shift their weight to the painful side, what they'll do is they'll drop down, all right? Well, what that's doing is causing the hip not to turn on the way it's supposed to, and it compresses that side of the spine. So we want to fix that. So what you want to do is when you shift over to that painful side, what I ask a lot of people do is to reach that same arm up in the air and lengthen and lift that rib cage and really try to stretch through that side, and then bring the arm back down. And what that's doing is teaching you how to load on that side without contracting that side bending pattern, and instead load it while maintaining a lengthened and relaxed waist muscle relative to the other side. That would be my recommendation to start practicing. And frankly, you can do this when you're sitting and when you're standing at a desk or wherever. You're going to start practicing loading that side that you assume has the side bending pattern, and then learn how to lengthen that side while it's loaded. And I bet you'll find that your sciatic pain or SI joint pain or unilateral back pain will start to melt away very rapidly, because you're teaching that side how to weight bear correctly. Okay? Well, I hope that helps. It's a very simple solution, but it's a very powerful solution for most of my sciatic, unilateral back pain, and SI joint pain patients. So I hope that helps. Thanks for listening.